It is time now to answer some of your questions about COVID-19. And joining us this evening, Dr. Michael Curry, an ER doctor at Delta Hospital just outside Vancouver. And Dr. Curry, I know you had a chance to enjoy the fantastic weather we've had here in Metro Vancouver this weekend. And so here's our question. As the weather does start to get nicer, how do we continue to practice safe social distancing while being outside in public places?
Well, Ian, one of the great things about being outside is between the sunlight and the wind, it's probably safer in terms of COVID infection than you are inside. But the same rules apply as has been brought up throughout this pandemic. Make sure to keep a 1 meter distance around all people, so 2 meters between two people. Make sure you wash your hands after touching shared surfaces, and also try to stay inside and don't go outside if you have any symptoms that suggest you may have COVID-19.
So as you were out and about today, was it pretty easy to do all those things?
It was. There was a little bit of crowding in our parking lots, but if you just time it, stay inside your car until the people near you have left, it's easy to keep that 2 meter distance. But you do have to think about things a little bit, but definitely try to get outside and exercise, enjoy the weather when you can. Just be safe when you do so.
Next question is about sports. I know you're not a sports administrator, so from a medical perspective, let's go to this question now. Would contact sports have to wait for a vaccine before their seasons resume?
Not necessarily, Ian. It depends on your risk tolerance. So if you're in an area that has a relatively low rate of COVID, what you're acceptable doing is going to be different than in a high-risk area where there's still a lot of COVID transmission. It also varies on the sport. So for instance, in Manitoba, with very low levels of COVID-19, the Gimli Baseball League might be able to resume play. It would be a different story for, say, the Quebec Long-Term Care Workers Basketball League to resume play. So it depends on the risks that we're willing to tolerate and the amount of COVID-19 in the community where the sport's taking place.
Okay, we have maybe 20 seconds, although I do want to ask you about the Gimli Baseball League, but we'll leave that for now. At your hospital, the emergency room in Delta, what are you seeing these days?
We're seeing things returning to normal. Things were very slow several weeks ago, and we think people were avoiding the emergency department. We're getting less seasonal flu, less respiratory tract infections, and our patient visits are coming back to what we would expect at this time of year.
Dr. Curry, always great talking to you. Thanks.
Thank you, Ian.
And of course, if you have any questions on COVID-19, just let us know. You can get us at Instagram at CBC The National or email us covid@cbc.ca.